I'm Fire Medic Melissa, and you're watching A Medic Minute with the McLean Volunteer Fire Department. I'm here today with EMT in training John.
Hi.
Because today's topic is aimed at helping EMTs understand the diagnostic value of monitoring a patient's blood pressure during transport. When we take a blood pressure, we're measuring the force of blood that's pushing up against the walls of the arteries when the heart pumps. John, can you tell us what a normal blood pressure is?
Let's see. So normal blood pressure is 120/80. The top number, the 120, is your systolic pressure, which is the pressure when the heart is beating. The lower number, the 80, is the diastolic pressure, which is when the pressure is being measured in between heartbeats.
Right, so 120/80 is going to be normal for your average person. If a systolic is over 180, it means they're at risk for a hypertensive crisis. So they're in the risk zone for a heart attack, a stroke, or even acute kidney failure. And a diastolic less than 60 means we're worried about blood volume loss. So are they bleeding out? Have they been in a massive trauma? Are they super dehydrated?
So that's blood pressure. What about pulse pressure?
Okay, so pulse pressure is the difference between the systolic over the diastolic. So for a normal, 120 minus 80 or 40.
So a low pulse pressure means that the heart isn't working well enough to perfuse blood throughout the body.
Right, or you could say a narrow pulse pressure. But either way, that puts them in an increased risk for throwing a clot.
And so a wide pulse pressure means that the heart is working harder to perfuse because it's running into some kind of resistance?
Possibly. Or it could be a sign of increased intracranial pressure if you also have bradycardia and irregular breathing.
So that makes sense. There's also a MAP measure. Can you explain that?
So MAP is mean arterial pressure, which is the average of the systolic and the diastolic over each heartbeat.
Well, that's very interesting. I think I have a better understanding of the value of the different ways that you can measure blood pressure. So thank you.
My pleasure. And thank you for watching A Medic Minute with the McLean Volunteer Fire Department.